Hello, everyone. My name is Mike Rooney with IWP. IWP stands for Injured Workers Pharmacy. We are a full-service pharmacy built exclusively for injured workers, for work comp patients. I am joined today by Neil Welch, who is a licensed pharmacist. He's our Senior Director of Clinical Operations, and also Danielle Jaffe, who is our Director of Legal and Government Affairs. And really what we wanted to do today is cover the COVID-19 pandemic, and let's address this from really a clinical standpoint and a regulatory standpoint. So, Neil, why don't I start with you? If you could just give us a general overview from your clinical perspective.
Sure. Yeah, happy to. I think there's significant differences in how prescribers and patients have been interacting recently. I think that there's difference also in regulations that is affecting the practice of pharmacy and the practice of patients receiving their medications. Things like telemedicine and allowing pharmacy and operational staff to operate and to help patients remotely wherever possible. Even in some cases, they're changing day supply restrictions and allowing pharmacies to exhibit better judgment to allow patients to make sure that they receive the medication during the pandemic. I think there's also, from a pharmacy perspective, some supply chain strain. We've seen that with items of really important need like ventilators, but it's also happening with pharmacy medications that are traditionally available, breathing medications, things like that. I think in general what we're starting to also see is really hyperspeed clinical trials. We've seen the development and implementation of vaccine clinical trials at a faster rate than we've ever seen before.
Yeah, I think from a regulatory perspective, we're seeing a lot more of our governors than we have in the past. They have daily briefings, especially in those hardest hit states. And we're also hearing a lot of terminology that we weren't familiar with up until now. I think shelter in place and stay-at-home orders are big topics that up until now are rarely used or used in a small setting where maybe an active shooter type of situation. But now we're getting these orders from our government to stay home. So shelter in place and stay-at-home orders are basically the same thing. They're asking people to stay at home as much as possible, only leave when it's essential to do so. So that's why you see businesses like grocery stores, pharmacies, gas stations remaining open so that people can get the services that they need. But we're asking everyone to kind of be home and stay home as much as possible. The term quarantine has also come up a lot, and I don't think before this pandemic we used it too often. When we're talking quarantines, unlike the stay-at-home and shelter-in-place orders, quarantines are individual. So it's issued usually by your doctor or Department of Health, either on your state or city level. And it's asking you to stay home literally for at least 14 days. And unlike those other orders that apply to everyone, you're not supposed to leave your house at all. It's usually because you've been exposed to COVID-19, you might have been exposed, or you have the illness. And so we're trying to keep people home. It's a different reach of government than we're used to. But we're keeping people at home to kind of flatten that curve, stop the spread. And so I think that's a whole new world for us on the regulatory side that we're not used to before this pandemic.
Yeah, and to your points, both of you, there's so many different people that are affected here. The people that, the first responders, people that are healthcare professionals, people that, delivery folks. This pandemic has changed their work lives, exponentially, really. And then think about, for us, the injured workers that we treat and that physicians are treating, the attorneys that represent them. Those folks that are just trying to get their normal medical care have been affected by all this. So let's kind of transition in the next part of telemedicine. That is really the trend that we're seeing over and over again. Let's have both of you guys address it from your points of view. Danielle, why don't you kick us off on telemedicine?
Yeah, so telemedicine, I think, is a trend we've been seeing for years. But this pandemic, much like staying at home is all of a sudden a thing, the pandemic has really pushed that forward into the forefront. It allows providers, practitioners to meet with their patients from their homes so that when you're staying home or not supposed to leave, you can still get that necessary medical treatment or guidance that you would otherwise not be able to get. So I think telemedicine has kind of come to the forefront as we explore ways to adapt to our new situation and see how we can still function every day, get those essential services that people need from the comfort of our home.
Yeah, Danielle, I think you're absolutely right. Telemedicine may be one of the things that we could say as a result of this national tragedy that we're able to say has been a positive change in the way physicians can visit patients. So to kind of back up a minute, telemedicine and telehealth, you'll hear those terms used somewhat interchangeably. It's the practice of remote medicine. So instead of a physician in the traditional sense or a prescriber seeing a patient and having a visit in their office, they're able to have a visit remotely. And that's through the use of technology. It can be something as simple as a phone call, or it could be as advanced as an app that allows for video and audio communication. So there's an assortment of products out there to allow physicians to do that. And it really just allows physicians to really perform a physical exam in the comfort of the patient and oftentimes the physician's home. Um, Boards of pharmacy, boards of medicine, DEA has all relaxed regulations regarding the use of telemedicine to allow it to be used, especially more in this pandemic world that we're living in now. I think one thing to highlight specifically to IWP is how we fit in very well into that workflow. If you think of how a physician would be prescribing a medication, as a result of the visit, if you're using a traditional pharmacy, oftentimes you're going to have to go into the pharmacy to pick up the medication, really exposing you to everything you're trying to avoid. With IWP, we've done this a long time. We deliver right to patients' homes. Prescribers can often use electronic prescribing or e-scribing to get the prescriptions to us with an immediate time frame, and we're able to get it to the patient's house oftentimes the next day. So I think one of the things, if we think about from a business in a way that we can provide value to our patients, I think this presents a unique situation where IWP can fit into really some preventative measures for patients.
And I think when we talk about, I think when we talk about telecommunication as well, we're seeing it in other areas on top of medicine. So court systems are still functioning, but people aren't allowed in the courtroom. They're trying to limit the public that's coming in if they're even open. And so what we've seen a lot is, especially in the workers' comp system, where the cases and claims are still moving and we still need decisions, we've seen a huge push for teleconferences, video conferences like we're doing today, electronic signatures in ways, again, that we can continue to adapt and keep systems and essential services moving forward from being home. So along with telemedicine, we're seeing a huge push for telecommunications that we haven't seen before.
Perfect. So let's continue on that conversation, guys, as far as what are the preventative measures that are being taken by IWP that you're noticing out there? How are we adjusting to this? So Neil, why don't you start us on preventative measures you're seeing?
Yeah, absolutely, and that's changed significantly since the beginning of this pandemic, and it really in response to both federal and state guidelines on how best to prevent the exposure and prevent the continued transmission of the disease to other people. So, first we'd have to talk through social distancing or physical distancing. So that's just simply being farther away from people than really would be norms in general. They talk about 6 feet in between people and to not gather in groups and to stay out of crowded places. So I think by this point, we're all doing that. The working environment presents additional restrictions and additional points where a person, if they can't work remotely, has additional risk. So I guess the first point is, if you can work from remotely, most employers are allowing their employees to work from home. But there are certain functions and jobs that really can't be done at home. I mean, pharmacy is a good example. You still need somebody to actually physically count and place the medication in the vial. I think there's ways that even in that scenario, you can mitigate some of the risk factors associated with the transmission. That includes the wearing of facial coverings and masks where appropriate, to continue those physical distancing or social distancing guidelines wherever possible in the workplace. Try to spread out the employees and how often they're in the same room together, maybe creating multiple shifts. The use of additional safeguards such as gloves. For example, in the pharmacy, we use gloves when we're handling medication. When people are in close quarters together, that they're always wearing masks, and they're even wearing masks when they're not in such close quarters. We also have a sign-in for all our pharmacy staff that says that they are free of any fever or symptoms, and they have to sign that every day. Just some of the ways that we're taking to prevent the transmission and exposure, and it's continually changing based on guidance from CDC and Mass Board of Pharmacy and other boards of pharmacy guidance governing how we practice.
And on the state level, I think we're seeing preventative measures, obviously, with all the orders and restrictions on what we can and can't do, but we're also seeing a lot of proactive steps for workers. So it's a state-by-state thing, just like every other workers' comp system, but we've seen a lot of states take initiatives to provide extended benefits or easier to access benefits for those first responders, or how we call frontline workers. So people deemed essential are now qualifying for workers' comp for COVID-19 exposure in certain states. Washington State, which was one of the first states hit hardest by COVID-19, had issued an order that said if you had to be quarantined because you were exposed, you'd get 2 weeks of pay. Last night, the governor of Illinois actually issued an order creating a presumption that if you're a first responder or an essential worker and you are diagnosed with COVID-19, it's going to be presumed to be a work comp injury. So it's making it a little easier for people to get benefits. So we're seeing some of those more proactive measures that we don't normally get to as quickly or as easily in a workers' comp system. But I think the long-term effect, we're gonna have weeks and months of debate between legislators and politicians and insurance people about what's covered and what's not. And it's just because we're not used to this. We haven't really had to explore it in the past. So how does our system that wasn't expecting COVID-19 deal with COVID-19? So we're gonna see that. It's gonna be a long debate, but we're kind of watching it play out on the state-by-state level.
Outstanding. So let's finish with this. I think the question becomes, how can we at IWP help? How can we be of assistance during these uncertain times? And I would offer two themes. Number one is, this is our 20th year in business, and all we've ever known is home delivery. The experts are clear on this. The safest place for any of us is our own homes. So let our home delivery service be of assistance in that regard. Again, that's all we've ever known is home delivery of medications. And then finally, I would say for those that are an injured worker, if you found the work comp system to be confusing or intimidating or frustrating, we totally understand that. And quite honestly, the system is difficult. We're experts. Again, work comp is all we've done for 20 years. Let our team of 200 plus experts help you through this. Your job as the injured worker is to be well, stay safe, take care of your health. Let us assist with all those frustrations. So we hope you enjoyed the information here. Everyone, please be safe and be well out there, and take care.